Question 141. A sterile processing technician is collaborating with a cross-functional team to tackle a massive backlog of unwashed vendor loaner trays in the decontamination area. To ensure this high-stress physical interaction is successful, what is the single most critical interpersonal factor the technician must exhibit? A. A consistently positive and cooperative professional attitude. B. Absolute punctuality regarding their physical time clock punches. C. Unquestioning loyalty to the specific shift supervisor. D. The ability to work independently without peer cooperation. Correct answer A. Knowledge point explanation. Core rationale. Effective teamwork in a high-stress clinical environment relies heavily on human relations skills. While punctuality and cooperation are vital, a positive attitude is the absolute foundational factor. An employee who maintains a respectful, helpful, and adaptable attitude physically fosters a collaborative environment, enabling the team to overcome workflow bottlenecks without interpersonal conflict. Trap analysis. Option B. Clocking in on time is a basic employment requirement, not a collaborative interpersonal skill. This option would be correct if the scenario asked what specific administrative metric human resources monitors to evaluate an employee's basic reliability. Option C. Blind loyalty does not resolve complex mechanical workflow issues. This option would be correct if the scenario described an outdated, authoritarian management model that discourages frontline technicians from reporting safety concerns. Option D. Working entirely alone is the exact opposite of cross-functional teamwork. This option would be correct if the technician was assigned to securely scan and file highly confidential patient records in an isolated, restricted administrative office. Concept extension. A negative attitude acts as a dangerous physical barrier in the department, causing communication breakdowns that can directly lead to unsterile instruments being mistakenly deployed to the operating room. Question 142. After discovering a punctured jug of peracetic acid leaking onto the floor, an SP technician urgently needs to review the exact flammability and exposure risks. According to federal worker safety mandates, how must the facility physically manage the specific documents detailing these chemical hazards? A. They must be continuously accessible and physically available to all employees at all times. B. They must be physically locked securely inside a dedicated administrative storage cabinet. C. They must be stored exclusively inside the department manager's private office. D. They must be maintained strictly by the facility's dedicated security officer. Correct answer A. Knowledge point explanation. Core rationale. The Occupational Safety and Health Administration strictly enforces the worker's right to know regarding hazardous materials. The law absolutely mandates that safety data sheets must be physically present, completely unlocked, and instantly accessible to every single employee across all operational shifts so they can rapidly access emergency first aid and spill containment instructions. Trap analysis. Option B. Locking chemical hazard sheets creates a fatal delay during a severe spill or splash emergency. This option would be correct if the scenario asked where a facility must physically store the highly confidential employee disciplinary and payroll files. Option C. Keeping the binders in a private office restricts access when the manager is off duty. This option would be correct if asking where the original budgetary purchasing contracts for the new automated washer disinfectors are filed. Option D. Security officers do not manage sterile processing chemical logs. This option would be correct if the scenario asked who actively monitors the physical surveillance camera feeds covering the hospital's exterior loading dock. Concept extension. If the facility transitions from printed yellow binders to a digital safety data sheet database, the dedicated computer terminal must remain permanently unlocked, powered on, and physically located directly inside the active wash room. Question 143. To legally renew their credentialing and physically master the complex loading protocols of a newly purchased automated washer disinfector, a veteran SP technician engages in ongoing professional development. Which specific combination of physical activities successfully fulfills this continuous learning requirement? A. Only physically reading peer-reviewed surgical journals during their scheduled lunch break. B. Simply maintaining their original, entry-level clinical competencies without seeking new operational challenges. C. Exclusively attending the mandatory annual Human Resources Bloodborne Pathogen Lecture. D. Actively attending industry conferences, executing hands-on equipment training, and participating in targeted educational sessions. Correct answer D. Knowledge point explanation. Core rationale. Professional development is a multifaceted requirement designed to prevent clinical stagnation. It requires a diverse combination of physical actions, including traveling to professional conferences, actively participating in targeted in-service webinars, and executing hands-on training to thoroughly master newly deployed medical technology. Trap analysis. Option A. Reading journals is beneficial but insufficient on its own to fully meet comprehensive continuing education credentialing quotas. This option would be correct if describing a supplementary, informal method a technician uses to independently stay updated on microscopic pathogen research. Option B. Stagnation is the exact opposite of professional development. This option would be correct if describing the precise behavioral mindset that leads to a technician failing their annual skills audit. Option C. Basic hospital-wide OSHA compliance lectures do not usually grant specific sterile processing credentialing units. This option would be correct if asking what singular physical training event every single hospital employee must legally attend. Concept extension. Certified technicians must retain physical or digital certificates of attendance for every educational session they complete, as credentialing bodies frequently conduct randomized audits to verify compliance. Question 144. During the mandatory morning quality assurance protocols, an SP technician deliberately crushes the inner glass ampoule of a biological indicator and places it directly into the incubator block without ever exposing it to a steam sterilization cycle. What is the exact scientific classification of this specific unsterilized physical testing device? A. A verified positive indicator test. B. A false negative diagnostic reading. C. An internal process challenge device. D. An untreated biological control vial. Correct answer D. Knowledge point explanation. Core rationale. To scientifically prove that a biological indicator is functional, the technician must incubate an untreated vial from the exact same manufacturing lot as the test vial. This unsterilized unit is formally classified as a biological control. It acts as the baseline scientific proof that the microscopic spores were alive and viable before the actual test vial was subjected to the lethal autoclave cycle. Trap analysis. Option A. The control will eventually turn positive, but verified positive is the resulting status, not the name of the device itself. This option would be correct if asking what the final physical color change of the fluorescent liquid signifies after a 3-hour incubation period. Option B. A false negative means the spores survived sterilization but failed to grow due to a defective incubator. This option would be correct if describing the dangerous clinical outcome of a broken thermal block failing to properly heat the test vial. Option C. A process challenge device is a physical barrier pack that houses the test vial during the active steam cycle. This option would be correct if the technician was physically placing a sealed plastic diagnostic cartridge onto the bottom rack of a fully loaded surgical carriage. Concept extension. If the untreated biological control vial fails to exhibit a physical positive color change indicating spore growth, the entire batch of indicators is deemed scientifically invalid and must be immediately discarded. Question 145. An SP technician is stationed at the 3-compartment sink, preparing to manually process a pile of bloody orthopedic reamers. Which specific physical action represents a critical quality assurance process exclusively executed within this highly contaminated environment? A. Precisely measuring the chemical dilution ratio of the enzymatic detergent added to the water. B. Actively verifying the mechanical cutting functionality of a delicate tissue scissor. C. Meticulously following the printed instructions listed on a surgical case cart pick list. D. scanning the external barcode on a terminally sterilized rigid aluminum container. Correct answer A. Knowledge point explanation. Core rationale. Quality assurance occurs at every stage of processing. In the decontamination zone, physically measuring the exact amount of enzymatic detergent using graduated pumps or specialized cups guarantees the correct chemical dilution ratio. If the solution is too weak, the biological soil will not dissolve. If it is too concentrated, it leaves toxic residues on the instruments. Trap analysis. Option B. Testing the mechanical sharpness and functionality of scissors is executed in the clean assembly zone. This option would be correct if the technician was utilizing red testing material to check a Mayo scissor at a brightly lit prep workstation. Option C. Utilizing a pick list is an operational distribution process performed in the sterile storage area. This option would be correct if the technician was physically pulling an unwrapped plastic basin from a wire shelf to build a surgical delivery cart. Option D. Scanning terminally processed containers is a tracking function performed on the clean side. This option would be correct if the technician was digitally logging a cooled tray into the dedicated sterile inventory tracking database. Concept extension. To further secure this specific quality process, many facilities install automated chemical dosing systems plumbed directly into the sink, completely removing human error by mechanically dispensing the exact volume of detergent required for the specific sink capacity. Question 146. An SP technician is physically preparing a surgical tray for a patient suffering from severe appendicitis. By analyzing the medical suffix of this specific diagnosis, the technician understands the patient is experiencing which exact physiological condition? A. A malignant tumor growing inside the targeted organ. B. A severe physical inflammation of the targeted anatomical structure. C. A complete mechanical rupture of the surrounding muscle tissue. D. An abnormal widening or dilation of a major blood vessel. Correct answer B. Knowledge point explanation. Core rationale. In medical terminology, the suffix itis definitively translates to inflammation. Therefore, appendicitis dictates a physical condition where the patient's appendix is actively swollen and inflamed, often requiring immediate surgical intervention. Trap analysis. Option A. A malignant tumor utilizes the suffix -oma, such as a carcinoma. This option would be correct if the technician was reviewing a pathology report for a melanoma diagnosis. Option C. A rupture utilizes the suffix rexus. This option would be correct if describing the traumatic bursting of the patient's spleen, known as splenorexis. Option D. Abnormal widening utilizes the suffix ectasis. This option would be correct if the surgeon was treating bronchiectasis in the respiratory system. Concept extension. Understanding these diagnostic suffixes helps the technician anticipate the potential bioburden levels. Highly inflamed, infected tissues like a ruptured appendix often result in significantly heavier organic soil on the returning surgical instruments. Question 147. While physically evaluating the water quality at the decontamination 3-compartment sink, an SP technician identifies a heavy, chalky white residue scaling the interior of the stainless steel basin. This specific physical phenomenon indicates the municipal water supply contains an excessively high concentration of which exact elements? A. Dissolved oxygen and pure hydrogen gas. B. Synthetic chloride and liquid fluoride. C. Hard dissolved minerals primarily consisting of calcium and magnesium. D. Highly acidic organic enzymatic proteins. Correct answer C. Knowledge point explanation. Core rationale. Water hardness is strictly determined by the physical presence of dissolved inorganic minerals, primarily calcium and magnesium. When hard water is heated or allowed to physically evaporate, these minerals precipitate out, leaving behind a destructive, chalky white scale that severely damages surgical instruments and mechanical washing equipment. Trap analysis. Option A. Oxygen and hydrogen are the fundamental chemical building blocks of water, not the cause of hard mineral scaling. This option would be correct if asking what elements are physically separated during a reverse osmosis purification cycle. Option B. Chloride and fluoride are municipal additives for public health and water treatment, but they do not cause thick white scaling. This option would be correct if the technician was testing the tap water for specific corrosive halogens that cause pitting on stainless steel. Option D. Enzymatic proteins break down bioburden and do not form inorganic mineral scale. This option would be correct if the technician was explaining the active cleaning agent utilized in the first compartment of the manual sink. Concept extension. To physically combat this scaling, the sterile processing department must install mechanical water softening systems to actively exchange these hard calcium and magnesium ions for softer sodium ions before the water ever enters the washroom plumbing. Question 148. An SP technician is stationed at the clean assembly table, tasked with physically verifying the operational sharpness of a heavy orthopedic bone curette. To strictly comply with standardized quality assurance protocols, the technician must execute this mechanical test utilizing which specific physical testing medium? A. A brightly colored sheet of thin latex material. B. A standardized plastic or acrylic dowel rod. C. A tightly woven square of disposable cotton gauze. D. A specialized single-ply paper facial tissue. Correct answer B. Knowledge point explanation. Core rationale. A bone curette is a surgical instrument engineered with a sharp, spoon-like tip to physically scrape and remove dense bone tissue. To properly test its mechanical sharpness without damaging the blade, the technician must physically draw the curette across a solid plastic or acrylic dowel rod. A properly sharp instrument will bite into the plastic and shave off a tiny curl without slipping. Trap analysis. Option A. Latex or TheraBand material is exclusively utilized to test the cutting mechanics of surgical scissors, not bone scrapers. This option would be correct if the technician was testing the distal tips of a delicate tenotomy scissor. Option C. Cotton gauze will instantly fray and leave microscopic lint fibers trapped on the instrument. This option would be correct if describing a prohibited testing practice that physically introduces foreign body contamination into the sterile field. Option D. Facial tissue lacks the structural density to test a heavy bone scraping tool. This option would be correct if the technician was gently dabbing the fragile optic lens of an arthroscope to remove residual moisture. Concept extension. If the curette simply glides or skips smoothly over the surface of the plastic dowel rod without biting into it, the technician must physically reject the item and dispatch it for professional mechanical sharpening. Question 149. While programming a dynamic air removal steam sterilizer for a massive load of wrapped orthopedic implant sets, the SP technician must physically input the strictly validated exposure parameters. According to national AAMI standards, what is the exact minimum time and temperature required for this specific physical cycle? A. 30 minutes of physical exposure at exactly 250 degrees Fahrenheit. B. 4 minutes of physical exposure at exactly 270 degrees Fahrenheit. C. 15 minutes of physical exposure at exactly 275 degrees Fahrenheit. D. 60 minutes of physical exposure at exactly 140 degrees Fahrenheit. Correct answer B. Knowledge point explanation. Core rationale. Dynamic air removal sterilizers, pre-vacuum systems, physically utilize a mechanical pump to forcefully extract air from the chamber, allowing instantaneous steam penetration. For standard wrapped instrument trays, the industry-validated minimum baseline parameter for a dynamic air removal cycle is exactly 4 minutes of physical exposure at 270 degrees Fahrenheit, 132 degrees Celsius. Trap analysis. Option A. 30 minutes at 250 degrees Fahrenheit is the standard parameter for a gravity displacement sterilizer, not a dynamic air removal system. This option would be correct if the facility was utilizing older technology that relies on passive physical steam displacement. Option C. While 275 degrees Fahrenheit cycles exist, they require only 3 minutes of exposure, not 15. This option would be correct if identifying an intentionally extended pre-on cycle parameter that exceeds baseline AAMI minimums. Option D, 140 degrees Fahrenheit is entirely insufficient for steam sterilization. This option would be correct if the technician was monitoring the sustained internal water temperature of an automated mechanical washer disinfector during the thermal rinse phase. Concept extension. Beyond the 4-minute exposure phase, the technician must also program an adequate physical drying time, typically ranging from 20 to 30 minutes depending on the load density, to absolutely guarantee the external wrappers do not emerge physically wet. Question 150. An SP technician is tasked with physically lifting a maximum weight 25-pound rigid aluminum container from a low storage shelf to place it onto a surgical case cart. To strictly comply with departmental ergonomic safety protocols and prevent musculoskeletal injuries, the technician must physically execute this heavy lift utilizing which specific mechanical body technique? A. Bending directly at the waist and relying heavily on the lower back muscles to hoist the container upward. B. Keeping the back perfectly straight, bending directly at the knees, and utilizing the powerful leg muscles to drive the physical lift. C. Extending the arms completely straight out and lifting the container physically far away from the body's center of gravity. D. Rapidly twisting the spinal column sideways during the upward lifting motion to quickly transition the container onto the cart. Correct answer B. Knowledge point explanation. Core rationale. Ergonomics is the science of designing the workspace to fit the worker's physical capabilities. To safely lift heavy rigid containers, technicians are explicitly trained to maintain a straight back, bend at the knees, and utilize the massive power of the quadriceps and glutes, leg muscles, to push upward, completely protecting the fragile lumbar spine from severe mechanical strain. Trap analysis. Option A. Bending at the waist is the leading cause of debilitating lower back injuries in the sterile processing department. This option would be correct if identifying the exact physical hazard the facility safety officer cited during a recent departmental audit. Option C. Holding a heavy weight far from the body multiplies the physical torque and stress placed on the shoulders and spine. This option would be correct if describing a dangerous physiological action that guarantees acute muscle tearing. Option D. Twisting the spine while bearing a load physically grinds the vertebral discs and causes catastrophic herniations. This option would be correct if the scenario asked what specific physical movement an employee must absolutely avoid when transferring a hot tray from a sterilizer carriage. Concept extension. If a rigid container or surgical tray physically exceeds the 25-pound maximum limit established by AAMI standards, the technician must immediately notify management and divide the instruments into 2 separate trays to mitigate the severe ergonomic lifting hazard. Question 151. A technician is moving an orthopedic tray directly from a steam sterilizer located adjacent to the operating room to the sterile field for immediate use. How should the technician physically transport this tray? A. Place a sterile physical drape over the open mesh bottom tray during transit. B. Carry the tray exposed if the patient area is less than a 5-minute walk away. C. Leave the tray on the sterilizer cart until the metal is completely cool to the touch. D. Enclose the hot tray inside a validated rigid container designed specifically for this transfer. Correct answer D. Knowledge point explanation. Core rationale. Immediate use steam sterilization items lack standard terminal sterile packaging and are vulnerable to environmental fallout. Transporting them requires a validated enclosed rigid system to shield the wet-hot instruments from cross-contamination during transit to the surgical suite. Trap analysis. Option A. Covering an open tray with a drape does not provide a validated microbial barrier for uncooled items. This would be correct if placing a sterile cover over a fully cooled terminally sterilized tray on a storage shelf. Option B. Proximity to the destination does not negate the requirement for a physical barrier. This would be correct if the scenario asked about the absolute maximum transport time for a specific time-sensitive biological sample, not sterile transport. Option C. Items processed for immediate use are deployed while still hot and do not undergo a standard cooling phase. This would be correct if the technician were processing a standard terminally sterilized load destined for the sterile storage room. Concept extension. The Association for the Advancement of Medical Instrumentation explicitly mandates that transport methods must actively minimize contamination potential, strictly prohibiting open transport of unpackaged sterile goods regardless of distance. Question 152. While sorting a heavy orthopedic tray at the assembly workstation, a technician spots a male Hagar needle holder with distinct gold plating on its finger rings. What internal component does this visual cue indicate to the technician? A. The jaws feature a diamond cut pattern designed specifically to grasp delicate sutures. B. The entire instrument shaft is coated in an ebonized finish to reduce overhead glare. C. The grasping jaws contain ultra-hard tungsten carbide inserts to enhance durability. D. The box lock mechanism contains a specialized self-retaining spring component. Correct answer C. Knowledge point explanation. Core rationale. Manufacturers apply gold plating to the ring handles of surgical instruments exclusively to signify the presence of tungsten carbide jaw inserts. This hard metal significantly extends the working life of grasping surfaces compared to standard stainless steel. Trap analysis. Option A. While needle holders have serrations, the gold rings specifically denote the material composition, not merely the cutting pattern. This would be correct if the question asked what texture is typically milled into standard needle holder jaws to prevent needle slippage. Option B. Ebonized finishes are black, not gold. This would be correct if the technician were inspecting an instrument specifically ordered for a laser surgery procedure to prevent beam reflection. Option D. Gold handles do not indicate lock types. This would be correct if the scenario asked how to identify a self-retaining retractor that automatically holds tissue open without manual assistance. Concept extension. Instruments with tungsten carbide inserts require specific maintenance. They should never be engraved on the insert itself and must be monitored closely for cracked or chipped jaws during routine inspection. Question 153. While physically loading rigid containers into a low-temperature ethylene oxide sterilizer chamber, a technician clips a personal dosimeter badge to their uniform lapel. Which federal agency legally mandates this specific chemical exposure monitoring device? A. The Food and Drug Administration. B. The Occupational Safety and Health Administration. C. The Environmental Protection Agency. D. The Centers for Disease Control and Prevention. Correct answer B. Knowledge point explanation. Core rationale. Ethylene oxide is a highly toxic sterilant, and safeguarding the workforce from overexposure falls strictly under occupational health regulations. The Occupational Safety and Health Administration enforces permissible exposure limits and requires active monitoring to ensure workplace air quality remains safe. Trap analysis. Option A. This agency regulates the efficacy of the sterilant itself, not the breathing zone of the employee. This would be correct if the facility were seeking clearance to market a newly invented low-temperature sterilizer to hospitals. Option C. This agency governs the external release of chemicals into the atmosphere or water supply. This would be correct if the scenario asked who dictates how the facility must safely vent ethylene oxide exhaust directly into the outside air. Option D. This agency issues infection control guidelines but holds no legal enforcement power over industrial chemical safety limits. This would be correct if the manager were looking for non-regulatory epidemiological data regarding hospital-acquired infection transmission rates. Concept extension. The permissible exposure limit for ethylene oxide is strictly calculated over an 8-hour time-weighted average, and failing to maintain records of this employee monitoring can result in severe federal citations for the facility. Question 154. A technician needs to document the sterilizer load number, date, and their initials on a newly assembled paper plastic peel pouch containing a single surgical scissor. Which specific tool should the technician use to write this information directly on the transparent side? A. A standard ballpoint pen. B. A graphite pencil. C. A non-toxic indelible felt tip marker. D. A sharp-tipped industrial permanent marker. Correct answer C. Knowledge point explanation. Core rationale. Labeling pouches requires a writing instrument that will not puncture the plastic barrier, bleed through the material, or release toxic vapors during the sterilization cycle. A validated medical-grade felt tip marker meets these requirements while ensuring the text remains permanently legible. Trap analysis. Option A. The rigid tip of a pen creates micro-punctures in the plastic film, instantly compromising the sterile boundary. This would be correct if the technician were filling out a standard paper logbook at the department front desk. Option B. Graphite smears easily fades under heat and cannot permanently adhere to the plastic film surface. This would be correct if an administrator were sketching a temporary layout design for a new decontamination sink on drafting paper. Option D. Industrial markers contain aggressive solvents that melt through the plastic or react dangerously with sterilants. This would be correct if a maintenance worker were labeling a heavy steel beam in the hospital boiler room. Concept extension. Technicians must never write on the porous paper side of the pouch, as ink can easily penetrate the cellulose fibers and directly transfer onto the surgical instrument inside, rendering it unsterile and hazardous. Question 155. While physically pushing a closed distribution cart loaded with sterile supplies, a technician must navigate through a transitional room designated as the anteroom. Based on medical terminology prefixes, what does the prefix in this specific room name dictate about the physical workflow? A. Personnel must use this space to work against airborne contaminants. B. Personnel must enter this staging space before accessing the restricted area. C. Personnel must keep this space completely apart from the main department. D. Personnel must operate in this space without mechanical ventilation. Correct answer B. Knowledge point explanation. Core rationale. The Latin prefix ante translates to before in English, indicating sequential order in time or physical location. In sterile processing facility design, an anteroom functions as a transitional zone that employees step into before they reach the main clean or sterile environment. Trap analysis. Option A. This definition incorrectly aligns with the prefix anti. This would be correct if the question asked for the meaning of antimicrobial wipes used to wipe down stainless steel tables. Option C. This definition incorrectly aligns with the prefix dis. This would be correct if the scenario asked what disconnecting a soiled hose from a pneumatic drill entails. Option D. This definition incorrectly aligns with the prefix a or an. This would be correct if the question required the technician to identify anaerobic bacteria that thrive in lumen channels completely lacking oxygen. Concept extension. Understanding basic medical prefixes is critical for interpreting equipment manuals, surgical schedules, and architectural layouts, ensuring staff move correctly through the progressive zones of the department. Question 156. While performing visual inspection on a compressed nitrogen hose used for a surgical drill in the decontamination area, a technician must pay extra attention. What specific characteristic of this accessory creates a significant challenge for identifying residual bioburden? A. The overall length requires awkward coiling in the sink. B. The exterior material features a dark hue that conceals blood and tissue. C. The distal electrical connector is highly sensitive to moisture damage. D. The supply line cannot be physically separated from the main handpiece. Correct answer B. Knowledge point explanation. Core rationale. Pneumatic accessories are typically manufactured from black or dark blue materials to distinguish them from other cables. This dark coloration heavily masks organic soils like dried blood, demanding rigorous visual scrutiny under bright lighting during the manual cleaning phase. Trap analysis. Option A. While cumbersome length is a handling issue, not the primary visual inspection barrier. This would be correct if the scenario asked why a technician might accidentally drop a long endoscope during transfer to a soaking bin. Option C. Pneumatic hoses do not have electrical components, they transport pressurized gas. This would be correct if the technician were inspecting a powered camera cable with gold contact pins. Option D. These hoses must be detached for processing. This would be correct if the question described a specific sealed fully integrated ultrasonic handpiece that the manufacturer strictly forbids disassembling. Concept extension. Beyond visual inspection, technicians must ensure these hoses are properly pressurized prior to submersion, preventing fluid invasion that could internally damage the power mechanism. Question 157. When preparing a single Kelly hemostat for steam processing, a technician carefully selects a paper plastic packaging sleeve that leaves exactly 1 inch of clearance around the instrument. What is the primary clinical reason for avoiding an overly tight fit? A. A snug fit prevents the completed package from easily sliding onto the storage racks. B. Sufficient internal space is mandatory for initial vacuum extraction, steam contact, and subsequent moisture evaporation. C. Properly fitted sleeves prevent the sharp tips from puncturing neighboring wrapped trays on the loading cart. D. Selecting the smallest possible sleeve directly minimizes department expenditures on disposable packaging materials. Correct answer B. Knowledge point explanation. Core rationale. Sizing parameters dictate that pouches must be large enough to allow the physical expansion and contraction of the plastic film during pressure changes. This engineered space ensures all trapped ambient air is removed, saturated steam contacts all metallic surfaces, and residual condensation completely vaporizes during the drying phase. Trap analysis. Option A. Storage rack friction is not a clinical sterility parameter. This would be correct if a logistics manager were analyzing why rigid container bottoms are becoming scuffed during inventory rotation. Option C. Pouches should be placed on edge in designated racks, not crammed against wrapped trays where they could cause punctures. This would be correct if the question asked why technicians place tip protectors on sharp osteotomes prior to sterilization. Option D. Financial conservation must never override sterilization efficacy protocols. This would be correct if a purchasing director were presenting an annual budgetary review on supply chain optimizations. Concept extension. An overly tight pouch acts as a physical barrier that compresses the instrument, creating a microenvironment where a localized cold spot or trapped moisture pocket guarantees a sterilization failure. Question 158. A technician is assigned to process a batch of reusable respiratory therapy face masks using a dedicated thermal disinfection machine. What specific medium does this equipment utilize to achieve the required microbial kill level? A. An agitated bath of water maintained at temperatures between 150 and 170 degrees Fahrenheit. B. A chemical bath containing a concentrated orthothialdehyde solution. C. Pressurized vapor introduced into a sealed jacketed chamber. D. A low-temperature liquid chemical cycle utilizing stabilized peracetic acid. Correct answer A. Knowledge point explanation. Core rationale. Pasteurization relies exclusively on thermal energy transferred through heated water to destroy pathogenic microorganisms on semi-critical items. Operating significantly below the boiling point, this method thoroughly disinfects heat-sensitive plastics without melting them. Trap analysis. Option B. This describes a high-level chemical disinfection process, not a thermal pasteurizer. This would be correct if the technician were manually submerging a flexible intubation scope into a ventilated soaking basin. Option C. Pressurized vapor is steam sterilization which reaches temperatures far exceeding pasteurization parameters. This would be correct if the technician were processing a heavy stainless steel orthopedic retractor set. Option D. Peracetic acid achieves sterilization, not just disinfection through chemical oxidation. This would be correct if the technician were loading a specialized automated endoscope reprocessor designed for liquid chemical sterilization. Concept extension. Items subjected to pasteurization emerge completely wet and must be rigorously dried in a specialized HEPA-filtered drying cabinet before they can be safely packaged and distributed back to the respiratory unit. Question 159. A technician is arranging several solid-bottom stainless steel bowls on a multi-level carriage destined for a pre-vacuum steam sterilizer. How must the technician physically orient these items on the metal shelving? A. Position them in a flat upright stance resembling their standard use on a back table. B. Place them exclusively on the bottom shelf before loading any other wrapped trays. C. Tilt them at a steep angle to ensure gravitational drainage of formed condensate. D. Confine them entirely within a fine mesh wire basket to prevent shifting during the cycle. Correct answer C. Knowledge point explanation. Core rationale. Solid bottom items act as impervious catchments during the sterilization process. Tilting them on edge leverages gravity, forcing the denser ambient air to pour out and allowing the heavy water condensation to actively drain away from the metal surfaces. Trap analysis. Option A. Flat orientation turns the bowl into a pool, trapping air at the bottom and holding liquid condensate. This would be correct if a nurse were preparing a sterile field and pouring saline into the bowl for immediate surgical use. Option B. Shelf placement does not override the physics of condensation. A flat bowl on the bottom shelf will still pool water. This would be correct if the technician were loading a heavy dense orthopedic set that could crush lighter items below it. Option D. Baskets provide organization but do not address the critical orientation required for drainage. This would be correct if the technician were loading loose disarticulated instrument clamps into a mechanical washer disinfector manifold. Concept extension. If multiple nested basins must be sterilized together, the technician must interleave highly absorbent wicking material between each metal layer to forcefully draw steam in and extract moisture out. Question 160. While aggressively scrubbing a bone rasp in the decontamination sink, a technician accidentally punctures their heavy-duty utility glove and sustains a deep skin laceration. What specific anatomical tissue type composes the exterior protective layer that was breached during this physical task? A. Epithelial tissue. B. Connective tissue. C. Muscular tissue. D. Nervous tissue. Correct answer A. Knowledge point explanation. Core rationale. The human body external shielding, primarily the skin, is constructed from epithelial tissue. This cellular structure creates a continuous, tightly joined physiological fortress against microbial invasion, which is immediately compromised by a needle stick or scalpel cut. Trap analysis. Option B. Connective tissue forms the structural framework beneath the surface, such as bones and cartilage. This would be correct if the educator were discussing the damage caused when a heavy sterilization cart rolls over a technician foot, crushing the underlying bone. Option C. Muscular tissue governs bodily movement and organ contraction. This would be correct if the briefing focused on ergonomic strains and the severe lower back injuries caused by improperly lifting heavy instrument sets. Option D. Nervous tissue acts as the communication network for sensory impulses. This would be correct if the educator were explaining why a technician immediately feels sharp shooting pain the millisecond a hot sterilizer rack burns their forearm. Concept extension. Epithelial tissue not only covers the exterior skin but also forms the mucous membrane linings of the internal respiratory and digestive tracts, acting as a universal border guard against environmental pathogens. Question 161. While physically transferring a sealed sterile instrument cart into the surgical core, a technician strictly follows specific transit protocols established by the Primary Professional Association for Operating Room Nurses. Which organization authored these specific perioperative handling standards? A. The Association for the Advancement of Medical Instrumentation. B. The Association of Perioperative Registered Nurses. C. An ambulatory surgery center. D. The International Organization for Standardization. Correct answer B. Knowledge point explanation. Core rationale. This organization represents the nursing professionals who actively manage the surgical environment. They develop comprehensive evidence-based guidelines that dictate how sterile processing personnel should interact with the sterile field, ensuring patient safety before, during, and after surgical interventions. Trap analysis. Option A. This entity publishes technical processing and equipment standards, not specific perioperative nursing protocols. This would be correct if the technician were looking up the exact biological testing frequency for a pre-vacuum steam sterilizer. Option C. This refers to a standalone outpatient surgical facility, not a standard-setting professional organization. This would be correct if the question asked where a patient might go to receive a minor same-day surgical procedure outside of a main hospital. Option D. This group develops broad international commercial and industrial quality standards. This would be correct if a manufacturing plant were seeking global certification for their quality management system regarding medical device production. Concept extension. While the Instrumentation Association focuses heavily on the mechanical aspects of decontamination and sterilization, the Perioperative Nursing Association focuses heavily on clinical workflow, environmental controls, and sterile presentation at the surgical table. Question 162. While physically inspecting and reassembling a complex orthopedic reamer at the prep and pack workstation, a technician listens to a colleague share an unverified story about a potential change in departmental leadership. What type of workplace communication network does this conversational behavior represent? A. Reviewing official departmental bulletins. B. Reading documented meeting minutes. C. Participating in the spread of rumors. D. Checking posted weekly work schedules. Correct answer C. Knowledge point explanation. Core rationale. Unofficial peer-to-peer conversations that circulate unverified information constitute the grapevine or informal communication network. This type of exchange is highly subjective, often inaccurate, and operates outside of the management-established informational channels. Trap analysis. Option A. Bulletins are formal written announcements distributed by leadership. This would be correct if the technicians were reading a memo signed by the director announcing a new uniform policy. Option B. Meeting minutes are formal permanent records of official departmental gatherings. This would be correct if the staff were reviewing the recorded decisions made during the previous month Infection Control Committee meeting. Option D. Schedules are formal logistical documents created by supervisors to manage labor. This would be correct if the technicians were looking at the staff board to see who was assigned to the decontamination shift next Tuesday. Concept extension. Professionalism in the workplace requires relying on formal communication channels for accurate operational updates, as informal networks can severely damage morale and create unnecessary anxiety among the processing staff. Question 163. While donning a heavy-duty face shield in the decontamination zone, a technician begins processing instruments under a newly installed negative pressure ventilation system. Which regulatory body legally dictates these specific workplace hazard controls? A. The Environmental Protection Agency. B. The Food and Drug Administration. C. The Occupational Safety and Health Administration. D. The Centers for Medicare and Medicaid Services. Correct answer C. Knowledge point explanation. Core rationale. The federal mandate to ensure a secure physical environment for healthcare workers belongs to this specific occupational authority. They enforce the implementation of engineering controls like targeted ventilation and the utilization of personal protective equipment to mitigate biohazard exposure. Trap analysis. Option A. This agency focuses on ecological protection and waste management. This would be correct if the management team were developing a protocol for neutralizing and disposing of expired high-level disinfectants down the municipal drain. Option B. This agency regulates manufactured medical devices and pharmaceutical products. This would be correct if the hospital were verifying the legal market clearance status of a newly purchased robotic surgical system. Option D. This agency oversees federal healthcare insurance funding and broad patient safety metrics. This would be correct if the facility were undergoing an inspection to maintain its funding reimbursement status based on overall patient infection rates. Concept extension. Non-compliance with these specific worker safety regulations can result in severe financial penalties for the healthcare facility and immediate shutdown of the processing department until the hazardous conditions are rectified. Question 164. While physically handing their printed professional curriculum vitae to the department manager to apply for a specialized lead role, a sterile processing technician ensures the document meets appropriate business etiquette. Which element must the applicant strictly exclude from this document? A. A detailed list of relevant technical certifications and skills. B. Strictly truthful statements regarding past employment dates. C. Attempts at informal humor or subjective jokes. D. Work history presented in a logically sequenced chronological format. Correct answer C. Knowledge point explanation. Core rationale. A resume serves as a formal objective inventory of an applicant's professional capabilities and history. Subjective elements like comedy are considered highly unprofessional, risk being misinterpreted by hiring managers and distract from the factual assessment of the candidate qualifications. Trap analysis. Option A, highlighting directly applicable capabilities, is the primary function of the document. This would be correct if the question asked what the most critical section to include for demonstrating competency in running low-temperature sterilizers is. Option B, absolute honesty is mandatory in all professional applications. This would be correct if the scenario asked what ethical standard must be upheld when detailing reasons for leaving previous healthcare facilities. Option D, organized chronological data is necessary for the reader to understand the applicant career progression. This would be correct if the question asked what format best allows a manager to review 10 years of ascending responsibilities in a sterile processing career. Concept extension. The initial impression made by a resume dictates whether the applicant advances to the interview stage. It must rely solely on precise action-oriented descriptions of technical achievements and educational milestones. Question 165. A technician assigned to the decontamination area is performing routine safety maintenance on the emergency chemical splash equipment. According to national safety standards, how often must the technician physically activate and flush the eyewash station to ensure proper functionality? A. Once every single calendar day. B. Once every 7 days. C. Once at the beginning of each month. D. Once every bi-monthly maintenance cycle. Correct answer B. Knowledge point explanation. Core rationale. The American National Standards Institute explicitly dictates that plumbed emergency eyewash systems must be visually inspected and physically activated on a weekly basis. This mandatory flushing clears the supply lines of stagnant water, mineral sediment, and potential microbial growth that could severely infect an injured worker eyes. Trap analysis. Option A, daily activation is excessively frequent and not mandated by standard guidelines. This would be correct if the technician were documenting the requirement for performing a dynamic air removal test on a pre-vacuum steam sterilizer. Option C, a 30-day interval is far too long and allows dangerous levels of bacteria and rust to accumulate in the plumbing. This would be correct if the manager were scheduling a routine departmental staff meeting to review upcoming continuing education opportunities. Option D, a 60-day timeline vastly exceeds safety limits for emergency equipment verification. This would be correct if the scenario asked about a less frequent preventative maintenance schedule conducted by facility engineers on the hospital HVAC system. Concept extension. During the weekly test, the technician must ensure the water flows for a sufficient duration to clear the pipes, completely verify the water pressure is adequate but not injurious, and confirm the water temperature remains comfortably tepid. Question 166. While scrubbing a heavily soiled orthopedic reamer in the decontamination sink, a technician considers the microscopic hazards present in the blood. Which specific pathogen type cannot swim or propel itself through the residual fluid because it entirely lacks the cellular structures required for independent motility? A. Spherical bacterial cells known as cocci. B. Rod-shaped bacterial structures known as bacilli. C. Organisms classified strictly as aerobic bacteria. D. Infectious genetic particles classified as viruses. Correct answer D. Knowledge point explanation. Core rationale. Viruses are not living cells, they are essentially inert packets of genetic material enclosed in a protein coat. Lacking flagella cilia or any internal metabolic energy system, they rely entirely on passive transport mechanisms like aerosolized air-water droplets or direct physical contact to travel between hosts. Trap analysis. Option A. Some cocci species possess limited motility and they are complete cellular organisms. This would be correct if the technician were identifying the shape of Staphylococcus aureus under a microscope. Option B. Bacilli often utilize flagella to actively propel themselves through fluid environments. This would be correct if the question asked which bacterial shape is primarily responsible for forming highly resistant endospores. Option C. Aerobic bacteria can be highly motile. This would be correct if the scenario asked what type of organism requires an oxygen-rich environment on the surface of an instrument to survive and multiply. Concept extension. Because viruses cannot move independently to seek out favorable conditions, strict adherence to manual cleaning and disinfection protocols easily physically disrupts their protein structures and washes them away into the drainage system. Question 167. A technician is processing a heavily soiled Fraser suction tube at the 3-sink decontamination setup. What physical action must the technician perform to effectively remove the internal biofilm and dried blood from this device? A. Flush the internal channel continuously with warm running tap water. B. Scrub the internal channel with a bristle tool matching the exact diameter and length. C. Submerge the device entirely in a concentrated enzymatic bath for 3 minutes. D. Push a solid metal stylet through the channel to clear out any visible obstructions. Correct answer B. Knowledge point explanation. Core rationale. The golden rule of lumen processing is that soaking and flushing are insufficient to detach sticky biofilms. Technicians must introduce mechanical friction by inserting a correctly sized brush through the entire length of the channel, pulling it completely through and cleaning the bristles before the next pass. Trap analysis. Option A. Flushing only removes loose superficial debris and will flow directly over an established biofilm without dislodging it. This would be correct if the technician were performing the final copious rinse step after all mechanical scrubbing is finished. Option C. Enzymatic solutions soften soils but rely on mechanical action for actual removal. This would be correct if the question asked for the mandatory first step to break down complex proteins before initiating manual scrubbing. Option D. Stylets are delicate clearing wires, not cleaning tools, and they do not scrub the inner walls. This would be correct if a surgeon in the operating room needed to quickly dislodge a bone fragment trapped in the suction tip during a procedure. Concept extension. Using a brush that is too small fails to contact the lumen walls, while a brush that is too large can buckle, break off inside the tube, or irreversibly scratch the delicate stainless steel interior. Question 168. A technician approaches a sterilizer cart that was pulled from the autoclave an hour ago. They need to verify if a wrapped orthopedic tray is safe to transfer to the sterile storage shelf. How must the technician measure the physical temperature of this package? A. Press a gloved hand against the outer wrap to feel for residual heat. B. Aim a non-contact thermal scanner at the package to read the surface temperature. C. Rest a bare, freshly washed hand lightly on the top of the package. D. Activate a countdown timer based on the estimated cooling parameters for that load size. Correct answer B. Knowledge point explanation. Core rationale. Packages cooling on a sterilizer cart must never be physically touched. To confirm an item has reached the ambient room temperature of 75 degrees Fahrenheit or below, technicians must utilize an infrared thermometer gun providing an objective reading without compromising the sterile barrier. Trap analysis. Option A. Touching a warm pack even with sterile gloves forces trapped vapor to condense and draws bacteria through the porous wrap via wicking. This would be correct if the technician were performing a tactile inspection on a completely cooled tray to check for loose tape. Option C. Bare hands transfer skin oils and moisture, acting as a vehicle for immediate microbial contamination. This would be correct if the question asked how a technician tests the temperature of the water bath in the manual decontamination sink. Option D. Cooling times are highly variable depending on tray density, room humidity, and ambient airflow. A timer cannot guarantee thermal equilibrium. This would be correct if the technician were tracking the required dwell time for instruments soaking in a high-level disinfectant. Concept extension. Moving a tray before it is completely cool creates a temperature shift between the warm metal and the cool ambient air, instantly generating internal condensation that results in a contaminated wet pack. Question 169. A technician is processing a coiled air hose used to power a surgical reciprocating saw. Before submerging the hose in the manual cleaning sink, what critical functional check must the technician perform? A. Wipe down the exterior casing utilizing a diluted acetic acid solution. B. Insert a flexible optical camera into the internal channel to check for debris. C. Coil the line and place it directly into the ultrasonic cleaner for cavitation. D. Connect the line to a designated gas source to inflate it and check for external leaks. Correct answer D. Knowledge point explanation. Core rationale. Pneumatic hoses convey compressed gas and must maintain absolute structural integrity. Before any fluid exposure, the technician must connect the hose to a compressed air or nitrogen source, pressurize the system, and inspect for escaping bubbles in water to ensure the internal pathway is perfectly sealed against fluid invasion. Trap analysis. Option A. Acetic acid is an aggressive chemical not utilized for standard bioburden removal on delicate surgical rubbers. This would be correct if the technician were attempting to dissolve severe hard water mineral scale from a stainless steel sink basin. Option B. Gas supply hoses should never have internal bioburden requiring optical inspection. This would be correct if the technician were inspecting the internal biopsy channel of a flexible colonoscope for residual tissue. Option C. Ultrasonic cavitation generates intense vibrations that destroy the microscopic seals and delicate valves on powered accessories. This would be correct if the technician were processing heavily soiled solid stainless steel orthopedic drill bits. Concept extension. If a pneumatic hose fails the leak test, it must be immediately tagged and removed from service. Processing a compromised hose allows water to enter the gas line, which will forcefully inject contaminated fluid into the sterile surgical field during the next use. Question 170. A technician is preparing to manually submerge a flexible laryngoscope into a basin filled with orthothaldehyde. What specific contaminant must the technician completely scrub off the device beforehand to prevent the chemical from immediately losing its biocidal efficacy? A. Residual moisture from the local municipal tap water supply. B. Residual patient tissue mucus and dried blood. C. Residual cellulose fibers transferred from paper packaging. D. Residual mineral deposits from a poorly maintained boiler system. Correct answer B. Knowledge point explanation. Core rationale. High-level disinfectants are designed to attack microorganisms, but they cannot differentiate between microbial cells and gross human soil. Any remaining organic matter instantly binds with the chemical active molecules, neutralizing the solution and shielding the underlying bacteria from the disinfection process. Trap analysis. Option A. While excess water gradually dilutes the chemical concentration over many uses, it does not cause immediate inactivation like proteins do. This would be correct if the question asked why instruments must be thoroughly towel-dried before placement in the soaking basin to maintain long-term minimum effective concentration. Option C. Cellulose fibers absorb chemicals but do not chemically neutralize liquid orthothaldehyde. This would be correct if the scenario asked what material absorbs vaporized hydrogen peroxide and triggers a cycle cancellation in a low-temperature sterilizer. Option D. Minerals cause mechanical issues and spotting, not immediate chemical inactivation of the disinfectant. This would be correct if the technician were diagnosing why the box locks on several hemostats were stiff and exhibiting a chalky white residue. Concept extension. This principle reinforces why the decontamination phase is the absolute most critical step in sterile processing. An instrument can be perfectly exposed to a sterilant or disinfectant, but if it is not completely clean, it will never be safe for patient use. Question 171. A technician is loading a sterilizer cart with several individual retractors packed in paper plastic peel pouches. To prevent wet packs and ensure sterility, how must the technician position these pouches on the rack inside the steam sterilizer? A. Position them vertically on edge, ensuring the porous paper side of one pouch faces the plastic side of the adjacent pouch. B. Position them vertically on edge, ensuring the transparent plastic side of one pouch faces the plastic side of the adjacent pouch. C. Lay them completely flat on the metal shelf with the transparent plastic side facing upward toward the chamber ceiling. D. Lay them completely flat on the metal shelf with the porous paper side facing upward toward the chamber ceiling. Correct answer A. Knowledge point explanation. Core rationale. Pouches must be positioned on edge like files in a cabinet, arranged paper to plastic. This precise physical orientation allows trapped ambient air to evacuate freely, enables saturated steam to penetrate the porous barrier, and provides a vertical pathway for condensate to drain away via gravity. Trap analysis. Option B. Arranging plastic to plastic creates an impermeable wall that blocks steam penetration and traps moisture between the surfaces. This would be correct if the question asked what specific loading error guarantees a sterilization failure and a wet pack. Option C. Flat placement allows water to pool directly on the plastic surface, preventing drying. This would be correct if the technician were inspecting the internal chemical indicator through the film at the prep and pack workstation before sterilization. Option D. Flat placement still prevents proper condensate drainage regardless of which side is up. This would be correct if the technician were placing a rigid solid bottom sterilization container flat onto the sterilizer carriage. Concept extension. Overcrowding the pouch rack compresses the packages, negating the paper to plastic spacing. Technicians must ensure a hand can slide easily between the pouches to guarantee adequate steam circulation during the cycle. Question 172. While physically retrieving a failed biological indicator vial from the incubator, a technician reviews why extreme heat permanently destroys the bacterial cell brain center, stopping its ability to reproduce. Which specific cellular structure is this concept describing? A. The semi-permeable cell membrane. B. The jelly-like fluid called cytoplasm. C. The dense central nucleus. D. The raw deoxyribonucleic acid. Correct answer C. Knowledge point explanation. Core rationale. The nucleus acts as the undisputed command center or brain of the cell. It houses the genetic blueprints and regulates all metabolic activities, cellular growth, and reproductive functions, making its destruction the primary goal of the sterilization process. Trap analysis. Option A. The membrane is the outer skin, not the brain center. This would be correct if the educator were explaining what exterior cellular boundary a chemical disinfectant must rupture first to enter the organism. Option B. The cytoplasm is the internal fluid that fills the cell. This would be correct if the question asked what substance physically suspends the internal organelles and allows nutrients to circulate within the cell wall. Option D. Deoxyribonucleic acid is the raw data or blueprint stored inside the center, not the center itself. This would be correct if the scenario asked what specific genetic molecule is actively scrambled by ultraviolet light or ethylene oxide gas. Concept extension. Understanding basic microbiology helps technicians grasp why strict time and temperature parameters must be met. Insufficient heat may shock the nucleus without fully destroying it, allowing the pathogen to eventually recover and multiply on the surgical instrument. Question 173. While actively assembling a rigid sterilization container at the workstation, a technician receives a documented corrective session from their shift supervisor regarding repetitive latching errors. What specific type of workplace interaction is the supervisor executing? A. An informal communication exchange. B. A formal disciplinary termination. C. A formal communication session. D. A long-term career mentoring relationship. Correct answer C. Knowledge point explanation. Core rationale. Coaching to correct deficiencies is an official managerial duty. Because it addresses job standards, utilizes a structured approach, and generates an official record, it is strictly classified as a formal communication method within the healthcare facility organizational structure. Trap analysis. Option A. Informal communication represents unofficial rumors or casual chats. This would be correct if the supervisor and technician were discussing their weekend plans while eating lunch in the hospital cafeteria. Option B. Termination is the final punitive step, not a corrective coaching session. This would be correct if the technician had deliberately bypassed biological testing protocols multiple times after receiving numerous written warnings. Option D. Mentoring is a voluntary broad developmental relationship. This would be correct if an experienced lead technician were guiding a newly certified hire through a multi-year program to become a department manager. Concept extension. Effective formal communication via coaching focuses purely on objective behaviors and established standard operating procedures, avoiding emotional attacks and setting clear measurable goals for the employee improvement. Question 174. While manually scrubbing instruments during a continuous 8-hour shift, a technician utilizes a newly installed height-adjustable sink and thick anti-fatigue floor mats to reduce severe lower back pain. What scientific process is the facility applying to this physical workspace? A. Ergonomics. B. The Employee Injury Reduction Plan. C. The Federal Worker Rights Program. D. The Departmental Risk Management Protocol. Correct answer A. Knowledge point explanation. Core rationale. Ergonomics is the applied science of specifically redesigning the physical workspace and tools to fit the worker body rather than forcing the worker body to adapt to a stressful environment. This science directly targets musculoskeletal disorders caused by repetitive motions and prolonged standing. Trap analysis. Option B. This is the administrative goal, not the physical science applied. This would be correct if the hospital administration published a statistical document aiming to lower overall workplace slip and fall accidents by 10% next year. Option C. Worker rights involve legal protections. This would be correct if a technician legally demanded to view the mandatory safety poster detailing their right to report hazardous chemical spills without fear of retaliation. Option D. Risk management is a broad liability umbrella. This would be correct if the facility legal team were reviewing liability insurance policies after a surgeon used a contaminated instrument on a patient. Concept extension. Implementing ergonomic principles not only complies with occupational safety laws but also directly increases departmental efficiency by reducing employee fatigue, minimizing sick leave, and lowering the frequency of assembly errors. Question 175. A technician is arranging a complex heavy orthopedic surgical tray for terminal steam processing. To ensure the load successfully passes all biological and chemical indicator tests, which physical preparation technique must the technician execute? A. Disassemble all multi-part instruments to guarantee the pressurized sterilant easily contacts every hidden surface. B. Pack the metal instruments tightly together to maximize the thermal heat transfer mass within the wire basket. C. Wrap the exterior of the wire mesh tray as tightly as physically possible to prevent any ambient air from re-entering the package. D. Place small delicate tissue scissors inside a sealed Tyvek pouch before laying them among the heavy instruments inside the wrapped tray. Correct answer A. Knowledge point explanation. Core rationale. The absolute fundamental requirement for any sterilization modality is direct surface contact. If an instrument features removable components, sliding shafts, or ratchets, it must be physically disassembled or unlocked so the sterilant vapor can freely reach and eradicate microbes on the interior friction points. Trap analysis. Option B. High density creates a massive metal heatsink that blocks steam penetration and guarantees wet packs. This would be correct if the question asked what specific assembly error triggers a low temperature alarm and aborts the sterilization cycle. Option C. Wrapping too tightly prevents the sterilant from penetrating the folds and can cause the material to rupture during pressure changes. This would be correct if the scenario asked what wrapping error frequently results in strike-through tears and compression damage to the sterile boundary. Option D. Placing a pouch inside a wrapped tray is an unvalidated double packaging method that traps air and prevents the scissors from drying. This would be correct if the technician were placing those delicate scissors independently on the sterilizer rack completely outside of any tray. Concept extension. Manufacturers provide specific instructions for use regarding exactly how far an instrument must be disassembled. Failing to remove a simple retaining pin can harbor enough surviving bacteria to cause a fatal surgical site infection.